Ready?
Yep.
So my name's Kathryn Harris. I work as a clinical scientist in the microbiology department at Great Ormond Street Hospital. I specialise in molecular diagnostic techniques such as PCR, which obviously have been extremely important during the pandemic. So back when everything started, back in March, although we had loads of expertise in our department for how to do these PCR tests, and we started developing like our own in-house testing. We were a very small lab, and there was no way we'd have had the capacity to do the testing that we needed, even for our own staff and patients, let alone what we were then asked to do, which was to provide staff testing for the whole of the North Central London region. So we called in some help from our friends at UCL, and in particular the Institute of Child Health, who were a team of research scientists who weren't currently able to work at UCL because it was closed, who volunteered to help us set up a service that was essentially increased our testing capacity by about 5-fold compared to what we would have been able to do. We also needed to use their equipment, so we were very lucky to be able to access equipment situated in the ZCR building at Gosh, which belonged to UCL. And so the combination of that team of people, which in the end ended up being about 20 volunteers over like different teams, allowed us to do a huge ramp up in our testing capacity. And I think the impact that had for us and for other trusts as well was that we were able to quickly screen staff and allow them to come back to work if they were negative, or to isolate if they weren't. And I think it had a real impact in keeping services moving at the time. What do I hope will happen next? So things have changed, because at the time obviously that was pretty full on, pretty stressful, because it was all being done at like very high speed, much faster than we would normally do it. We set the whole thing up from not even having a PCR that worked to having a full service within 10 days, which is really, really quick. So things have calmed down. We're still doing a lot of testing, but we've got ourselves into quite a good rhythm. It runs pretty smoothly. So I guess what I'm hoping for is that the autumn and winter will not see us back where we were before, and that we will have the testing capacity that we need to get through the rest of the year.